I'm Dr. Jerold Albright. I served in the United States Air Force. I was a captain. One of my assignments was to go to Vietnam as part of a medical team that consisted of another doctor and myself and some other ancillary personnel. We were sent to work in a Vietnamese hospital because the civilians were having difficulty getting medical care. I saw many different kinds of illnesses there that are not seen in this country, but mainly I worked treating war injuries, operated on a lot of people with many different kinds of injuries. One of the most interesting cases involved a young girl who was probably 12 years old. She she came into the hospital with both of her hands blown off, and we repaired those as best we could. The next day she told one of the nurses that she had an aunt who was a Viet Cong, and together they were trying to make a bomb. When asked what she was going to do with the bomb, she said she was going to put it in my Jeep. Fortunately, that didn't happen, and she paid quite a price for having tried to do that. We worked very hard to treat all of the patients that came to the hospital, both medical and surgical, and I felt like we really accomplished quite a bit during my tour over there.
Can you describe a little bit about the working conditions that you were forced to work under?
The hospital where I served was approximately 80-bed hospital. We averaged approximately 150 patients at a time, and so for most of the hospital there were at least 2 patients in a bed. We had limited medication we could use. The operating room was pretty primitive. There was no air conditioning. We had fairly good surgical instruments, but we had only ether anesthesia because it was cheap. We worked on a lot of people, including many war injuries, and even in spite of the conditions, I felt that our mortality rate was only about 10%, which I was pretty proud of. I felt like we were able to do some good for a lot of the Vietnamese people that we came in contact with. We did mainly surgical cases, but there were some medical cases that we consulted on also.
Was a majority of what you did amputations?
That was probably the majority, but there were abdominal wounds, facial wounds that we just had to try to patch people up again.
Was there any miraculous one that you can remember?
Considering the conditions that we had to work in, I felt almost all of them were miraculous. In spite of the horrible injuries, most of them were able to get well and go home.
Mm-hmm.
So he was a friendly. He came up to me and asked if I could do him a favor. And I said, sure, if I can. He said, there's a young girl who's probably 5 or 6 years old in the town. Her parents have a little store. This little girl has a hair lip or a cleft lip that had never been repaired. And she was so ashamed of it, she would just sit in the back of her parents' store with a towel over her face. She had no friends, she would not go to school, she really couldn't do anything.
Mm-hmm.
And this fellow asked if I could help her. I told him that I'm no plastic surgeon, but I think I can make her a whole lot better than what she is now. And the next time we don't have any war casualties, to bring her out and we would work with her.
Mm-hmm.
So he did, and I repaired that. And she came back a few days later, and it was really looking good. We got good results. I took the stitches out and sent her home. About 2 weeks later, I ran into this Vietnamese guy again who said, "Did you hear about the little girl?" I said, "No, what?" He said, "People are coming in from all over the province to see this little girl. She's completely changed. She's back in school. And it's just like almost a miracle, the changes that her surgery provided for her." So we felt real good about that. I think that AC thought maybe I was getting too much good publicity, and that's why they devised that bomb that they were going to put in my teeth.